Good afternoon, everybody. This is my fifth consecutive visit from Europe to APNA's conference. So he's always there here with APNA, and I'm thankful to Dr. Shekhar. He said not to mention his name. Global Ayurveda Conferences invited me. Is it right? Ayurveda Conferences. Fine. I just, yesterday I was walking nearby here. One gentleman was there. He was there just walking. He was telling me, what's going on there? I said, we are doing Ayurveda conferences. He is Indian man. Is it medicines are allowed in US? I said, I don't know about US. I'm from Europe. So we have some problems also there, like in US. And he said, why? So what you are using? He said, it's herbs we are using. Is it allowed in US? Again, he asked. I don't know. I must check with my colleagues here. Then I said, when it's marijuana has been standardized in US, marijuana can be sold legally. Why not your herbs? I said, I really don't know. I need to check this and let you know back. So it was interesting. And all these days, yesterday and today, we have gone through lots of theories, loads of theories. Can we have a shift from that today? Some little shift we'll make and see what we can do with a kind of clinical discussion we can have today. A practical approach, what we can, most of the doctors here, they can do much better even than me. As always, I tell everybody. And every individual doctor, they have their own approach, right? But still in Ayurveda, we need to standardize that. We need to standardize that. That's what this conference is meant for. The conference is meant for not only just bringing our notes and also the clinical knowledge. It's very, very important. In Europe, we do lots of clinical presentations in all the countries where I travel. It's very important for us. So that we shift here, and now we will come as usual. Usually I come up with some headache cases, nuisance cases, difficult cases all the time because I love it. It's always important, we are always trying to do some diagnosis or something, and now we are trying to do. But this is conference autoimmune disorders, very, very special, and a lot of speakers were speaking yesterday. My colleagues, Dr. Jay Gopal and my Dr. Vijay Jain, many people are talking about Basha. They're all talking about many things they stored. And many things I prepared. I don't know what to tell now because everything they told. So, yeah, and one more important thing is I have a lot of time to discuss clinically only more. So I can skip off all the theoretical aspects. So thankful to them. Right, now we will come to this women from Zagreb, Croatia. I traveled to this country, to Croatia and all these southern European countries, as well as Western European countries, Western European France, and Eastern European countries. I traveled a lot since 10 years. And this lady is my patient, and her name is, the topic we need to discuss, a case study of the Crohn's disease and its post-operative rehabilitation. Listen, I'm not going to tell you how I treated the Crohn's disease straight away and cured it. I'm working on a lot of cases. Rehabilitation is a very, very important problem. After the Crohn's disease, they undergo a lot of surgical things. We will go through it step by step when we are discussing it. And her name is Andrea Sekulovic. This is a Slavic names. Eastern European countries, they have different names. Slavic names is called as the roots of the languages. Age 40 years, city is Zagreb, and country is Croatia. I think it was. Did you heard about Croatia? Anybody here? Yeah. It has a border with Italy, Austria, Serbia, and Slovenia. So it's a beautiful country. They've got a lot of islands, 1,300 islands they have. One of the most beautiful countries which I admire a lot. So now next is, so we go the next step. Yeah, we'll see I put their intestines and all those things, stuff there, because we are working on the Crohn's disease. Mostly I will be talking about the rehabilitation. It's a very, very important rehabilitation. What we can do in Ayurveda is the rehabilitation, and this is a very important point also. The story goes like this for Andrea. In 1991 to 1995, because when the patient comes to me, it's already with Crohn's. Remember, I did not diagnose. Most of the Ayurvedic doctors, they do get the cases. We are safe doctors actually, because we already have a diagnosis in our hands. We are very safe doctors. And it's important that the chronic patients Ayurveda can do. I always tell my patients in all over the Europe, wherever I'm traveling, 99% we need to have Ayurveda or all the natural sciences. 1% we should have modern hospitals. It's very important that we can't treat everything. And we should not be living in the false word that we are Ayurveda people, we know everything. And my grandfather told me this, my father told me this, my grandfather was Ayurveda doctor, my forefather grandfather, so I know everything, I can do everything. It's impossible. It's impossible. When you travel into many countries, every country is different. The social, economical conditions, the geographical position of the country, it's very important to treat. You can't take just Indian knowledge, whatever we have in textbooks, just go to either country. It's highly impossible. You can't do it that one. And if somebody says that I have very success, I don't believe them. Because I've gone through the pains in every country wherever I travel. It's very difficult to treat. They don't understand Ayurveda that much easily. It's easy for us to sit and talk here, whatever we want, but it's not easy. Language barrier, different countries, different languages, different backgrounds, all these things. So this lady, Andrea, at the age of 17 years, that's way back to the history I'm trying to come up with, was noticed and detected Crohn's disease, the earlier, the 1991 itself, she was Crohn's disease, and most of us, we know what is Crohn's disease, and yesterday a lot of people was talking about these autoimmune disorders, Crohn's and other rheumatoid arthritis, so many things they were discussing, and I tried to remove that, all those things. I don't want to waste my time. So I got hospitalized many times with the pain abdomen, loose stools, and had steroids. Steroids, usually in European countries, I don't know here, they use more Imuron. You see here? Imuron here? Imuron. So the immunosuppressants they use a lot there in Europe. And of course, methotrexate, everybody uses there also. And had steroids also, corticosteroids she was using. A lot of times she was going to the hospitals. Every 2 months once she was in a hospital. Would you believe? Pain abdomen, go to hospital. Admitted, come back. Again pain abdomen, then the diarrhea, all those things, and a lot of bleeding in the stools. So we all know the characteristic feature of the Crohn's and what are the symptoms, features. I don't want to tell everything which you people know it. Let me tell what I have done for the patient. Let me see the improvement factors for the patient. That's very important. Theoretically, we all know, many people have spoken this, I don't want to repeat again. And because of the steroids and Imuron, she developed hepatomegaly. Hepatomegaly means enlargement of the liver. So it was going on like this, and again 1995 to 2001, 2002, she was still having a lot of pain abdomens and recurrent problems in the menstrual cycle. There is a changes in the menstrual disorders, and she was having a lot of hormonal imbalances, and she was having 92 kilos. She dropped down to 39 in this process. So one of the significant factors, if you see, remember the significant factors of symptoms of Crohn's disease is loss of weight, am I right? It's a huge loss of weight. You may think it's a cancerous patient or what, but she lost enormous weight, 39 kilos. She was 39 kilos with a huge anemia in the hand, and so many things, CRP and all those things. We will come to that later. And anemia is, Pratibha also was talking about the anemia factors, all those things. It's a very common factor in Crohn's disease, severe anemic conditions there. And 2002, started having repeated again episodes of diarrhea. She is going to the hospital regularly, but in 2002, it became worst. That was the beginning period she started thinking differently. Till that time, she was going to hospital regularly. After repeated episodes of diarrhea, frequent temperatures, was advised temporal colostomy. I think you people know this, you know, some of the people. Colostomy, temporarily they make the intestine outside the body and try to evacuate the stools factor, all those things. Colostomy they were done. Right, this story has keep coming still. So after 2002 to 2003, she had another lot of bouts of episodes of this bleeding, diarrhea and all those things, and they decided, that's it. Anymore, we are not going to wait for you. We are going to go for colonectomy. So they have removed total colon proctocolon, including rectum. It's called proctocolonectomy. It's finished. So all the colon has gone. Now they have, the patient came to me in this condition, the ileostomy they have done. That means the ileocecal junction, the most of everybody knowing, the intestine, the small intestine which is towards the cecum, that was removed, and it is the ileum the ileocecal junction is removed, and it's being put into the abdominal wall, and all of the evacuation is done through the back. It's a ileostomy, proctocolonectomy. We'll come to that later. I will explain you in stage by stage how they have done and what they have done. We'll come through that. So proctocolonectomy they have done, which is large colon, because if you see the Crohn's disease, most of the area which affects is the colon, large colon, and the later portion of the small intestines, which is going towards the ileocecal junction. Right. So that was the colostomy they have done. Then 2003, again, what happened? Colonectomy they have done. So they tried their level best to minimize the degenerations of the mucosal layer. That is, we call in Ayurveda, Pittadhara Kala. Also, we can internal mucosal layer, Pittadhara Kala. So now I will come to the Ayurvedic aspects later a little bit. But I don't want to exactly compare the Crohn's with the Grahini, but we'll try to understand. If there is my mistake is there, please help me. Right. In 2009, she was with me. She met an Ayurvedic doctor. I'll show you her letter. She wrote quite beautifully about me. Not that I'm beautiful or something. But what I have done for her, she was trying to explain. This is the love of the patient. When they try to, most of the doctors, they must have been experienced more than me. It's the love they express to you. And she was on Ayurvedic treatments. I'll explain you that also in the end, when we are working on the provisional diagnosis and differential diagnosis. At that place, I will explain you what are the herbs I used for her and what was the reaction she got, and still she's with me. She's from 2009, still she's with me. It's 2009, she was taking Ayurvedic treatments, what I will tell you later. And in 2 months, she started improving with Ayurvedic approach. What I have done, again, I'll come back to you later. This is just in history. And 2010, 2011, she did not come to me because I thought maybe she's not feeling well and something happened, or maybe I don't know. And I was thinking, if a patient doesn't come to you, what we don't know. Then she surfaced after 1 year. She said, I'm fine, I don't feel I have any problems now. I'm doing well. Oh, thanks God, that's fine. But again, she came for just workout, then she went, and again she came back with, in 2009, believe me or not, she came with the severe pain abdomen and low anemic levels, and a lot of distensions, pain abdomen, again, temperatures. Even though colonectomy was done, that's the beauty here. So by the colonectomy, after the colonectomy was done, proctocolonectomy is done. What is proctocolonectomy? What happens there? The anus is sutured completely. There is no anus anymore. She can't evacuate anymore because there is ileostomy bag outside. She's living with colostomy bag since long time. Ileostomy bag since long time. So she came to me in that condition. So what is my role here? My role is to rehabilitation. Even though they have done that, patient is undergoing serious problems like pain abdomens and all those things. In 2014 and 2015, she came again to me, and she was, the beauty is that she started developing arthritis again. She started developing arthritis, multiple arthritis everywhere, and the migraine. So I had a tough time with this case. Either I had to treat the Crohn's or migraine or arthritis. What to do? It's a complications, a lot of complications is coming up. Every patient doesn't come with single problem. There will be always tail between that. When you finish, another tail will come. The more the time we are spending, the more the problems we face. It's not easy treating this kind of autoimmune disorders. Now next is, you can see this appreciation letter. She wrote me there. I can't wait to see Dr. Suresh, something she wrote there. Very beautiful. Fine. And this is me, not my brother. Me, and this is Andrea Sekulovic, and she's a wonderful person. That was taken in Croatia. Now, let us see a little bit about the Ayurvedic point of view. This is very important because what we need